Elena, nice to see you today.
Nice to see you, me too.
You look very nice.
Thank you so much.
You look very healthy too.
Yeah, because
I just saw your echoes.
Yeah.
It looks perfect. The hole is completely closed. You were born in Russia,
I was born in the Azerbaijan, and my mom, she's pregnant. When I was pregnant, and she was in the car, and she has an accident, and that's why I was born with hole, and I was when I was, and she told her, don't put a name, because today ago she died. And my mom don't give me name, and every time she told me so.
That's okay, Linda. So it's a very beautiful story that she was born premature. And since she was born premature, she was born with a hole in the heart with a ventricular septal defect. And at that time, the physicians thought that it was lethal. And so they recommended not even to give her a name. But the mother didn't believe that and took her away. And she grew up as a normal child, isn't that right? She grew up as a normal child and actually with reasonable activity. And then finally, later when you were already grown up, you went to Turkey, right?
Yeah.
And when she was in Turkey, they would examine her and they would say that she had this loud murmur, and they said, you need to be operated right away and with open heart surgery, and she didn't want it. So she didn't want surgery.
Yeah, and then go to Israel.
You went to Israel?
Yes. And doing in Israel is all the stuff, and he told me, no, you don't need the surgery. And I say, oh my God, if I don't need it, then I go to the...
So that's what it is. So what it probably was is that the hole, as you grew older, became smaller in size. And that's why when she was in Israel, the physicians correctly said that you just have to observe it. You don't need to operate. And she did well in Israel, and then that's where you met your husband.
Yeah.
Right? And they got married over there. Then finally, they came over to the US, and she did well in the US too, till only about few months ago when Dr. Milstein saw you.
Milstein.
And what I did see at that time, she was very mildly symptomed, right? Mild symptoms, but her heart size had increased in size over years, suggesting that it was necessary to close it. But the good news was, because tissue had grown around the hole, there was enough rim around the hole for me to use some of these closure devices and do this procedure without surgery. So then I recommended that to her, right?
Yeah.
And you were agreeable to that?
Yes, I agree with Dr. Kar, and I have to thank you for Dr. Kar.
No, you don't have to thank me. What I did was unique in the sense that usually when we close holes in the ventricular septal, it's actually quite a complicated procedure. You need to have a venous access and arterial access, and then create a rail and then advance a sheath. Her hole was small enough that we could use a specialized device which is used to close defects in infants and can be threaded through a very small catheter. So I learned this technique actually from a physician in India. So the devices, and he actually taught me this technique, but he would do it through the groin. But because she was an adult, I actually did this through the radial artery. And I think this is probably one of the few cases. I had done this case before in a previous hospital where I worked. And this is probably the second case. And this is one of the few cases in the world which have been done through a radial artery.
2 weeks after.
No scar.
No scar.
So as I mentioned, that because I used a very small device, I could thread it through a very small catheter. So I went through the radial artery just through the wrist. The procedure, as you can see, at the end of 2 weeks, there's actually no scar at all. and her recovery was very rapid. And there are only a few cases in the world done for this procedure through the radial artery. I looked at her echo right now, and the echo looks perfect. It's closed the hole, and there's no abnormalities in the heart. And I think you will start to show changes in the heart function and the size over time. And you were complaining of some weakness in the heart. I think this will also improve over time.
Thank you so much.
And thank you for cooking a meal for me today.